Welcome to Billing Buddies podcast. Today we're going to talk about the no opt-out Medicare rule. This is a rule that affects certain specialties. Chiropractic is one of them, and so is osteopath. If you go to cms.gov, and type in opt-out rule, it'll bring up the specialties covered. There's several of them. MD is not one of the no opt-out rules, but to opt out of Medicare, an MD has to have a 2-year waiting period and sign certain forms, and it's way more detailed. So today's podcast is really directed at the ancillary providers, and particularly chiropractic and osteopath. What the no opt-out rule means is you can't opt out of Medicare, meaning not become a Medicare provider, and still treat Medicare patients. So it puts you in an awkward position, the chiropractic and osteopath specialties, because when your Medicare provider presents themselves, if you haven't become a Medicare provider, either a PAR provider or a non-PAR provider, either way you have a contract with Medicare. If you haven't done that, your only option is to refer them elsewhere. You can't treat a Medicare beneficiary. Now, I've had providers say, well, these people wouldn't have qualified for Medicare anyway because they don't meet the medical necessity guidelines, and they wanted to pay cash, and I've heard all kinds of excuses to do this, and I can see why it would make sense, but the rule is the rule, and you can pull it at cms.gov. The reason you can't treat a Medicare patient, even if they wouldn't qualify or they want to pay cash, is because they're covered under the federal program, and there could, under certain circumstances, be coverage. And a Medicare beneficiary, when they don't meet medical necessity, signs an ABN and has the option for the provider to bill Medicare. And obviously, if a provider hasn't enrolled in Medicare, they couldn't possibly abide by the rules of billing Medicare. Where providers get caught doing this wrong is if mom and dad get older and the kids take over the bills and they start trying to figure out why mom and dad are paying cash and Medicare isn't paying, and they call Medicare, and that sets up a Medicare review. If you have any questions about this, I've become pretty experienced. I've had 3 providers, not that we did billing for, but that contacted me later to assist them in an audit where they had been billing Medicare patients cash and they weren't Medicare providers, and they didn't know it was in violation of the no opt-out rule. This would be a perfect topic to put in your compliance manual. I've talked a lot about compliance manuals that everyone should have. And if you were one of those providers that does not take Medicare beneficiaries, you would want to address that in your compliance manual as well, that you refer them out to other providers and do not treat nor take cash from Medicare beneficiaries. Again, if you have any questions, give me a call, 612-432-2366. Again, that's 612-432-2366. And our tagline is Buddy Up with the Best. If you ever need billing services, I'd be happy to talk to you. The number I gave you, you can call or text. Thank you and have a fabulous day. Take care. Bye-bye.